Hello, moms and dads. I hope you are all enjoying your new journey with your newborn baby. A lot of number of time, the parents bring their child to our A&E with different concern. But we need to understand when your child has to be in A&E. There are some red flag signs that we need to understand. We need to keep them in our mind all the time. First thing, if your child all of a sudden started having some jerky movements and rolling of eyes, any bluish discoloration, dusky discoloration, or looking really very pale as white. If the child all of a sudden started showing the neck stiffness, arching of the body, and jerky movement, this could be the sign of convulsion. If all of a sudden a child started having some respiratory distress, too much sucking in there, too much sucking between the ribs, too much sucking in the tummy, and breathing like this, like panting. Normal newborn baby do fast breathing, take pause, again fast breathing. This is how they breathe. But if it is persistently there with some nasal flaring, then we need to worry. They are obligate nasal breather. That means when our nose is blocked, we open our mouth to breathe. But for the newborn baby, they don't have that kind of reflex. For that reason, if the nose is blocked, then they are in stressful situation. They would try to take the breath through nose, and if that point of time milk has been offered, they are much more in bigger trouble. In those cases, they started refusing feeds. So we need to make sure nose is clear. How we can clear the nose? There are some saline nasal drops available over the counter. Just put 1 drop each nostril. Wait for 10-15 minutes. Then encourage the child to have feed. I can assure this time you would have a better response. Then we need to think about some blue discoloration or any dusky discoloration all of a sudden. It could be the sign of heart disease as well. And if it is associated with weight loss, refusal of feed, please bring the baby to us. We will check thoroughly. Next, if the baby all of a sudden started showing a lot of vomiting or any green vomiting, projectile vomiting, repeated number of times, then it could be one of the ominous signs. If the baby all of a sudden started watery diarrhea, profuse watery diarrhea, then it could be a problem. It could be due to acute gastroenteritis. The color of the stool could be yellow, could be greenish, but when we need to be worried, if the color of the stool is pale as white, like clay, that is bad sign. Or if you find any blood there, that is also a red flag sign. If the baby is not passing urine more than 8 hours, that is also a bad sign. The baby can pass stool 3 to 5 times in a day or once in 3-4 days. So these are the things that you need to keep in your mind to make sure your baby is alright. I hope you enjoy the video. Please like, share and subscribe. See you in next video. Thank you.